Welcome to my podcast. Today I'm going to talk about another common condition. So basically, after you introduce yourself and double check the patient name and date of birth, you'll ask the patient, how can I help you today? So the patient might have issue with smoking and he wanted to understand what he can do and what's the problem are associated or related around smoking. So basically, you will either give him a leaflet or give some information and ask the patient what would you like to know the most. So generally speaking, you will just raise their awareness about the health risk associated with smoking. So you can start off with the head and state it can cause mouth cancer, can cause throat cancer, can affect your larynx as well, can affect your esophagus, which is the gullet, can affect the stomach, pancreas, liver, kidney, bowel, bladder. So it can affect also the heart in different ways. It could lead to blood circulation issue and cause peripheral vascular disease and can affect the heart and could cause heart attack and stroke. Also, it can affect the hearing and the vision, which can be lost with time due to peripheral vascular disease or if it's associated with diabetes. It could lead also to infection or healing if there is a wound, if there is a surgery. It could lead to erectile dysfunction and impotence in men and infertility, both gender. So it's basically the biggest cause of death and illness in the UK. And also, we have to mention about the smoking and its relation to lungs. So it could cause chronic lung disease in the form of chronic obstructive airway disease, bronchitis, which could lead to chronic cough, emphysema, which could lead to alveoli, inflammation, and then there will be like a sac, which is irreversible, and infection of the lung, which is pneumonia. Also, we need to mention about the dental problem. As I mentioned before in one of the podcasts, it will lead to bad breath. It will lead to gingivitis, which will lead to recession of the gum and dullness of the gum, pocket around the teeth root, and loss of the teeth later on with callus formation. It's one of the most causing of anyone living with debilitating smoking-related illness, and it make those who are smoke, it make them ill, feeling unwell, especially if they catch common cold. And we have to mention about the passive smoking because people might think that if they are living with someone who's smoking, they are more immune or they won't get what they are getting. No, it's second-hand smoking, so you will get cough, asthma. It will affect your lung as well. It might cause lung cancer because of the carbon particle and because of the inhalation of that smoke of the person who's around you. And in pregnancy, it will lead, of course, to miscarriage, premature birth, low birth weight of the baby, and maybe intrauterine fetal death, which is basically fetal death in the womb, and stillbirth. So that's basically smoking related health issue. And I have to mention that vaping, which a lot of people think they are nicotine free, they aren't. They have traces of nicotine and they are not free from the nicotine at all. However, they, in comparative to cigarette, they could be less, but they still have, and there is a lot of evidence which shows that there is health issue with vaping. I wrote a paper about it before, so you can search for that paper if you like to read more. Thank you.